Hi, I'm Dr. Rachna Kucheria. I'm a family physician with over 27 years of experience in India and in the United States. I treat all kinds of ailments from flu, fever, coughs, to diabetes, blood pressure, high cholesterol, as well as mental health problems like depression, anxiety, panic attacks. During my years of practice, I've had a special focus and passion for looking after the elderly, especially the older elderly over 85-year age group.
Hi, I'm Dr. Roshan Jain, a practicing psychiatrist in Bangalore. I have over 22 years of experience in psychiatry, addiction, psychotherapy, teaching and motivational work. I have been offering teleconsultation, which I think is particularly suited for mental health consultations, counseling and therapy, as it offers higher confidentiality, convenience, and can be done in the comfort of your own space and at your leisure.
Last year, we started realizing that some of these patients are going to come back to see us. Remember, we had shut down outpatient clinics. We had moved down to telehealth, video. We were not seeing these patients in person. We knew that a myriad of issues are going to come up with these patients. So we started what is known as a post-COVID clinic. So what is post-COVID or long COVID as a term is being used? These are issues that patients are facing once they have had COVID, and symptoms and signs are persisting long after one would have expected them to have fully recovered. And this was a little bit surprising for us in certain set of patients who we thought had fully recovered, who had mild disease, and we probably thought they would not have any lingering persisting symptoms, but we started noticing that patients were complaining. We definitely knew that patients who were in the ICU or step-down units with severe COVID, they would have issues later on. So let's start by talking about what are they facing. And luckily for us, research is being done at a very rapid pace. So not only from our experience, our own research, we are also seeing research papers that are basically corroborating our findings and what our patients are facing. So the most common symptom that we have seen in our patients after they have recovered from COVID, no matter what type of COVID they had, whether they had mild, moderate, or severe, is fatigue. Now, every patient is not suffering from this. So I would say when you ask a patient when they come to your clinic, a lot of them, remember, they have gone back to their lives. They have to earn a livelihood. Some of them have lost their jobs. But when you ask them and you probe them, they come out and tell you, I'm just feeling tired. I'm just feeling weak. I just don't have any energy. We are also seeing that they're complaining of sleep disturbances. I think Roshan can highlight more on psychiatric issues. A lot of these people have had social issues, lost their jobs, lost family members. depression, anxiety, PTSD. My patient population has a lot of PTSD being veterans. So, exacerbation of the PTSD symptoms is being seen. As a pulmonologist, what I'm seeing is uh, the most common symptoms that are being called out by these patients are persisting cough, shortness of breath. Some people have weird chest pains or muscle aches. So this is what we are seeing, and we are trying to tackle them. We are trying to see how best we can help our patients, how best we can refer them to other specialists. Especially mental health. That is a major concern for. Just yesterday, I was talking to one of our patients on the phone. She said, I've been, she had mild COVID. I've been sitting in my house for 1 year doing telework. I'm going stir crazy. This is the term being used. So this is long COVID. Now, I would like to point out, if you remember in our medical books when we were studying in medical college, we used to read a term which we knew is never going to be asked in our exams. It's called the chronic fatigue syndrome. And if you really look at what is happening now, I think this is what it is. And we knew that at that time, some viral illness, some bacterial illness, or we used to, if we say agar MCQ आएगा, because the infectious mononucleosis answer कर देंगे. So Amit can answer, tell you more about that. So I have a feeling what we are seeing now is an extension of chronic fatigue syndrome in these patients who have had COVID.
Right, right. Thank you for that, Dr. Khosla. You're spot on. And just, a perfect segue into checking with Dr. Amit, who's a classmate of ours, as we know, and, one of the most brilliant people in college and after, and today practices in Delhi in a dense urban areas, serving both an urban-rural mix in Mehroli. I say this for a lot of our participants who are not from Delhi. And some of the most difficult areas to practice in terms of the density of people as well as the whole spectrum of illness. So he gets presented with everything, the most esoteric infections that you think probably are gone away, the seasonal ones, the non-seasonal ones, and of course all the chronic illnesses, with sometimes people with very few resources to be able to pay for the fancy tests, even a basic echo sometimes, which can be quite basic in as we know, for a heart patient. So Dr. Amit, I know, so welcome Dr. Amit, and thank you for giving us time this Sunday, precious Sunday evening. We know you don't get time off, you're round the clock. But how has your experience been, I will say, November to now? I know we've kept in close touch. In November, you could barely breathe, being a Delhi practitioner. What is the change in the symptoms and the problems that people are coming to you now versus what they were coming to you in November with Dr. Amit, if you could enlighten us?
Thank you, Rachna, for the kind words. I think the myriad of symptoms that we are seeing in a post-COVID patients is almost the same as Dr. Rahul has pointed out. The commonest symptom is fatigue, myalgias, breathlessness, persistent cough, arthralgias. Sometimes they come with tinnitus, anxieties, atypical chest pain, palpitations. Sometimes they come with rashes. And most of them, if you take their history, they've had COVID in the recent past, maybe about 2 months back, maybe about 3 months back. But these symptoms of fatigue, breathlessness, they are still persisting. So some of them patients, they have had an asymptomatic infection and still they are coming up with these symptoms. So these days we are getting their antibodies done, and if the antibodies are positive, then we come to a conclusion that probably these symptoms are post-COVID. Many of them have psychiatric symptoms. Anxiety, palpitations are very common, very common. Sleeplessness, insomnia, very common. Yeah, I think Dr. Roshan would be able to elaborate more on that.
Excellent. Thank you. So I'll just simplify for our audience here, because most of them are not doctors, what you've just said. So fatigue, myalgias basically means that both Dr. Amit and Dr. Khosla are seeing people with excessive tiredness, just lack of energy. I don't feel the energy I used to before. Body aches, my muscles ache, and they've had COVID, as he said, some 3 months ago, some 6 months ago. Some are even coming with feeling of palpitation or still some chest pain. And of course, a whole host of mental health issues, which, Dr. Roshan will come to in just a couple of minutes. So this is what he's seeing. Maybe some people, I'm seeing some people still have that persistent cough, feeling of niggliness in the throat. And we're seeing this, 3 to 6 months later. And what Dr. Amit said is that if he's finding some people with these symptoms and it can't be explained from our usual illnesses, usual diagnosis we make, he is getting an antibody test. So this means he's looking at those people who didn't know they had COVID, might be younger people, right, Dr. Amit? He's looking at those people,
right.
and then going backwards to see, is COVID the reason for all these unexplained symptoms that he's getting? So that is also, one way to to now diagnose them, and of course then have the empathy, and I'll come to some treatment options, etc. later, to help them along and at least come to some sort of a diagnosis, clarity about why they are having those symptoms. So having said that, Dr. Jain, Dr. Roshan Jain, I think all roads are pointing to you as the mental health provider. All the physicians are now looking at you. Dr. Jain, thank you so much for joining us this evening. I know you're a practitioner, psychiatrist between Bangalore, urban Bangalore and UK. So you have both experiences. And of course, you've been critical throughout the pandemic. You've been on other webinars with us. But I will say, on a personal note, that for all of us, I think, to do the work that we do and also make the changes in our practice that we've had to take hits like everybody, take exposures, all of that, we've had to keep our mental health intact. So, have been learning and from you through this time, and I'm grateful for it. So now, what are things that you are seeing in your practice now, Roshan, Dr. Jain, if I may, from maybe 3-4 months ago? What are the improvements, and what are still some areas of concern? Please do enlighten us.
Thank you, Rachna. And Roshan is fine. It sounds younger. And thank you for the kind words. And I think the digital media has allowed me to reach out to not just urban Bangalore, but most part of India, where people have reached out seeking consultations, advice and therapy and guidance for themselves and family. So the practice has spread across the country and across different countries in the world, thanks to video consultations. As you already know, I don't think we are in the post-COVID status. We are still very much maybe in the back end of the COVID status. In countries like India, the numbers have dropped, but in other countries like UK, US, the numbers are still rising. They're still peaking into second and third waves and so on. So we are at the fortunate end. And as we all know that COVID is very different. COVID crisis is very different to any other crisis. The fear of COVID has traveled further and faster than the COVID infection or COVID virus itself. The impact or psychological impact of COVID has been far more than physical impact. As I always said, the number of infections are far, far less than the psychological misery, the fear and apprehension and anxiety that it has brought on. And I would say that it is 100 times more, if not even more. In India alone, I think 70, 90 crore people might be infected with anxiety, stress and depression, many of whom we have still not yet seen. They have shunned away, they've become isolated, and they have not come forward despite digital consultations. So our expectations in this crisis has dashed many more times than in any other crisis. In other crises, earthquakes and tsunamis, we know that things are bad, then within few days it starts to get better and it gets improved, and then we start to see hope and so on, and we move on with our lives. 1 year on, we're still talking about the same issues. What does this mean for our emotional health? Well, it means not very good news. And a lot of people are suffering, very few are consulting. And as Dr. Rahul, as Dr. Amit mentioned very clearly, is that many are reporting physical symptoms of post-COVID, those who have got infected or those whose family members have infected, and those who still fear having COVID. So what we've seen in clinical practice is not just a straightforward stress, unrelenting stress manifesting as physical symptoms, anxiety manifesting as physical symptoms such as dizziness, giddiness, inattentiveness, impaired concentration, commonly reported muddled thinking. When you're very anxious and apprehensive, you can't think clearly. the blues, the fear of the COVID infection itself or getting second infection has led for people to become depressed. But what we've seen in Indian context or in world context rather is that hypochondriacal symptoms, the fear of developing illness, which is COVID or COVID related, phobia of health issues has dramatically increased. The symptoms of obsessive compulsive disorder, ruminating about illnesses and infections and developing complications has dramatically increased. Post-traumatic stress disorder, as Dr. Rahul said, where people are having recurring dreams and flashbacks of having acquired infection, having been diagnosed, being hospitalized, some even intubated, are not leaving them alone. Consequently, is causing them restless days and restless nights. Consequently, having insomnia at night, feeling unrefreshed, inattentive, tired in the daytime, and remaining even more fearful. So people who develop COVID infections, we are fearing COVID again, and people who have seen COVID infections in others are as fearful. So we are seeing a wide array of problems, and as both my all my colleagues will suggest, is that psychological symptoms present with such physical symptoms that we are now having difficulty in discerning the two, whether this is ongoing remaining symptoms of COVID infections, post-COVID infections, or is just anxiety manifesting as bodily symptoms. So, and that's very important to understand. Is it either of the two? Therefore, specialist consultations becomes even more important to help people differentiate between the two so that adequate treatment can be given.
Excellent. Thank you for that, Dr. Roshan. You've very concisely put a whole myriad in a simple manner of things people may be feeling. So giving them that validation. So thank you for that. But I do think, Roshan, also, I'm going to come back to you. And next, what we want to hear, because you've got questions as well, is that there's hope and there's good news. So yes, a large number of people can also be empathy with the family members, how family members can support and what they can do. And, we have the benefit of that in India. We have three-layer family members in many households. And of course, the web connects people internationally as well. And then what you are doing as a practitioner and what other physicians can do to help some of these symptoms, I'll come back to you with this. You've laid down the problems and the questions, but we will come back for hope and therapies and treatment starting right from home to what will send you to a practitioner and what you should see somebody about, what you can manage at home, how you should manage it, and what you should go to a doctor for and seek their help with. Great. So I will, I am going to talk about vaccines, and of course I'll ask my colleagues also to jump in, having had the vaccines themselves. So let me start with the two vaccines that have been approved in India. Bear with me. All right. So as of, I think yesterday, 56 lakh or so doses of both the Covishield and the Covaxin, these are the names in India, have been given out to healthcare workers. And of that, 3 lakh are now frontline workers. They've started vaccinating them as well. So this would include teachers and ASHA workers and other such, police and all of that. So Covishield, to put it very simply, is the vaccine being manufactured by Serum Institute of India. And it was developed by research done at Oxford University with the company AstraZeneca. So this is all the same. If you hear Oxford, AstraZeneca, Covishield, it's all the same vaccine. Currently, I'll talk about this one first. Currently, it's approved for people over 18 years of age. And it's given as 2 doses in the arm, what we call the deltoid muscle, and 2 doses that are 4 to 6 weeks apart. Now, there is an asterisk there. There are new information coming in every day, as I said, and I will talk about some of the new information a little bit later, but just this is the standard information for now. So this is 4 to 6 weeks apart. First doses are being done, and I think by very soon they'll start rolling out the second doses for those people who've had the first dose. Now, the commonest question we're getting is who should not get the vaccine? again, I'll start with Covishield. So with Covishield, with each vaccine, and actually with each new medicine or any medicine, there comes a package insert, which directs us physicians as to what was the research done, who it was done on, and how we should use it on what populations and where we should not. So it's very clear, it's in black and white. And on the package insert for Covishield, they do say that efficacy and safety data has been tested on more than and equal to 65, but is limited, and it's not to be given under 18 years of age. It should not be given to anybody who's had a severe allergic reaction to the Covishield vaccine itself. So let's say you got the first dose and you got a very bad allergic reaction, do not take the second dose. Or if you have allergy to any of the components that are in the vaccine, and there's a list of them when you are called for your vaccine, or you can even look it up on the internet. Too many chemical names for me to go through right now. If you have allergy to any one of those components, then you should not take it. Those are the absolute contraindications. They have not tested it on pregnant women and women who are breastfeeding. So caution there. Any of these women should have a discussion with their gynecologist, their obstetrician, and they will guide them if the risks are more than the benefits are more than the risks of the vaccine. Now, who are the caution group? And this is the group that we're getting the most questions from. It has been said that please mention and discuss with your healthcare provider, with your vaccinator, with your doctor, if you're having currently a fever, if you've had recently a COVID infection, if you are immune compromised. What does that mean? Either because of some illness you have, or if you're on medicines that could immune compromise you. So many people who do have these do know about it. So people who've had kidney transplants and are on medication, people who take long-term steroids for certain conditions that are autoimmune in nature, for those who have cancers. These are the commonest ones, but there are many, many other conditions. And this is where you do have to have a discussion with your doctor. Those who have bleeding disorders or who are on blood thinning medication. So these are all listed on the insert. You need to have a discussion with your doctor. It will be an individual case by case, especially as this vaccine will now be rolled out in March to the 27 crore over 50-year age group. See, up till now, it's been healthcare workers. So, there's an assumption, and rightly so, that most healthcare workers are aware of many of these things. They're able to quickly question, they're able to follow up, but now it's coming to the lay population. So I'm pretty sure the government will be coming out on further details. There'll be more communication about this. But while it does, just know that this is what the package insert says. And the government is handling the vaccination so far. So what I'm hearing in the news, you are also hearing that hopefully by March, they should be rolling it out to the over 50-year age group. Right now, the next in line have already started. That's the frontline workers. With that said, and a little introduction to the vaccine, to Covishield, which is also actually being given over in multiple countries all across the world, in the UK, in the US, and many countries in the EU and other countries. I'll come to the next vaccine when I come around from the panelists, asking some more questions about the post-COVID issues. So, Dr. Amit, I'd like to start with you. What kind of, I know in India, we have a large focus, and rightly so, because we have many systems of medicine. We have Ayurveda, homeopathy, and many of them are dependent on diets and such. So I'm sure you get this question all the time. Are there any kind of dietary advice, supplements, any kind of vitamins that you're suggesting to your patients who've already had the COVID? Also, then I'll throw it in there that, I know people have asked this throughout the pandemic. Is there anything I can take to prevent the COVID? So what is your answer to these questions, and any other care points that you talk about when you're talking to your patients who have COVID?
I think the first and the most important thing is reassurance. So if you reassure the patient that, look, there is a light at the end of the tunnel, so don't worry. Maybe it will take a few weeks, maybe it will take a few months, but at the end of it, you're going to be all right. As far as supplements are concerned, we generally prescribe patients to have either vitamin supplements or a diet which is rich in zinc, vitamin C, vitamin D, a good protein diet, and lots of hydration. They should keep themselves hydrated. They should expose themselves to sunlight. They should feel happy. They should be motivated. They should feel positive. And maybe we can send them for counseling also. And some symptomatic medicines, maybe a little bit of painkillers like a simple paracetamol, or maybe some anti-anxiety drugs, maybe beta blockers to curtail their heart rate, or maybe anxiety symptoms, they can also help.
Excellent. I think that's one of the most important takeaways you said is reassurance. And that's really important. And I know that all of us as healers, many times there is power in that, that things will improve. And, with our experience, we are usually able to say that this requires more attention, or just wait a while, this will get better. The body is an amazing machine. So absolutely right. Thank you so much. Reassurance, very important takeaway for those who've had the COVID and are still suffering from issues of it. And you said, stay positive and, have a positive mental energy, which we're going to come to Roshan in a minute. Dr. Khosla, how about you? Exercise is a question mark. There's continually evolving information on exercise. I've had patients who've had very serious complications, who went back to exercise very soon, young people. Also remember that, at least for us in India, many people are not diagnosed with blood pressure or even sugar or even things that affect the heart or even heart problems. So what is your general advice on exercise after COVID? It's a common question. What are you saying and what is a prudent advice?
I think it's an excellent question and a concern. Exercise is always good, but you have to see where you are. So where you were before COVID and where you are after COVID, and it also depends upon how serious of an illness did you get with COVID. So people who had mild illnesses were not really affected or were asymptomatic from it. Definitely they should, regular exercise is very good for the body. But people who have had severe COVID, who are in the ICU, who are on a ventilator, who have had, or maybe not on a ventilator, but high flow oxygen, and have had severe lung injury, or having persistent symptoms of shortness of breath or atypical chest pains, they need to be a little bit cautious. They need to work with their physician, first of all, to make sure that, proper diagnosis is being made, to make sure that there's not severe lung injury. Do they require oxygen? Small percentage of patients may require oxygen after having suffered what we call as acute lung injury, ARDS, or may have had some cardiac issues which were either pre-existing or have been exacerbated. So there have been a couple of research papers that have come out on the use of physical therapy, both during the episode of COVID and after. But we don't have much out of it, or too many papers out there. Definitely it helps. It helps with their quality of life. It helps with the exercise capacity. And people who have had lung injury, doing breathing exercises with, adding resistance to both inhalation and exhalation. There are devices which are out there, or you can do without devices. You can just do, in India, yoga is there, pranayam, exercises can be done. I tell my patients a very simple thing. You don't need expensive gadgets. Just take a balloon, think you're a kid and you have your birthday, and just keep, blow the balloon slowly. And that is an exercise for your lungs. So be careful. If you have had severe COVID, seek consultation with your physician so that they can make a proper diagnosis as to where you stand, and then maybe come up with an exercise regimen that may be good for you. So that's what I would say.
Great. Those are simple and followable enough. And I will put one word of caution here, just experiential, that when people do yogic breathing exercises, I think for the initial time, at least the Kapalbhati type may be avoided, because there is undue pressure in that deep pressure breathing, and starting with gentle walks. And as you said, simple things like balloon inflation. Those are advisable, but generally, summing that up, starting slow and steady, starting with a gentle walk, see how you're doing, and weekly increasing bit by bit is the safe way to go. I'm going to pause for a second and take a couple of questions before we come to Dr. Jain. People have asked about when can I get the vaccine, age 61, comorbidities, and allergic patients, can they go for COVID? Which vaccine is the best? and somebody had severe allergic reaction after 48 hours of the first dose. They had to be on steroid. Should I take the second dose? Off the top of my head, I would say that probably not. If you had that sort of a severe allergic reaction where you had to take steroids. Any comments, Dr. Amit, Dr. Khosla, on this one? Somebody's asked that they had a severe enough reaction to require steroids. Should they go for a second dose?
They should not. They should not.
They should not.
Yes.
Yeah. Okay.
I agree with Dr. Amit. I mean, you have to be very cautious. Now, the only thing we can add there is if you have the option to see an allergist, allergy immunologist, that's what we are doing over here. They may help guide you, but definitely I would recommend against it if you have had a severe reaction. Remember, these are the two contraindications for the vaccine. One is severe anaphylactic reaction, and the other is severe reaction after the first dose.
Excellent. So yeah, so I think to broadly put it here, no, don't go for the second dose. If you need further nuances, see a specialist. An allergy specialist would be best. People have asked, when can they get the vaccine? Not in our hands. In India, the government is making decisions about who will get the vaccine and when. And from what I am reading thus far, I think March will be the month where it probably will be rolled out to the over 50-year age group and those with comorbidities under 50. So that is what one is reading. I only have the news that we all have, but that is what I am learning. So you should be able to get the vaccine. And somebody asked, generally, I have allergies, should I take the vaccine? Again, it depends what kind of allergies you have. There's a whole variation. Somebody who just sneezes with pollen to people who require injections to manage their allergies. So there is a whole spectrum. I think that it would be best if you take a consultation or talk to your doctor before deciding if you're appropriate for the vaccine or not. I'll take more questions as they come along. Dr. Jain, over to you, and let's talk about fixing some of that mental health problems, you know, getting more cheerful, getting people more cheerful around us and bringing hope there.
Absolutely. And you quite rightly mentioned earlier that we as healers have an enormous role to play apart from treatment. And that role entails from the patient, the time individuals and family walk into our clinic, coming with worries, coming with queries and questions and expectations. And if those questions are answered before they're asked, then you got a winner, because the patients walk in with all sorts of tensions on the mind. And I tell the patients all the time that when you walk into the clinic, your worries are on the table and you leave them there. And that's what happens in counseling settings. Dr. Amit quite rightly said that we offer assurance, and Dr. Rahul touched on that as well. But I think we need to answer the queries, we need to address the expectations, and we need to give them a right amount of information for what they present with, and guide them. And in doing so, half the problems are solved. The other half is what we ask, well, the other 25%, we ask them what they need to do, which makes them better. And the remaining 25% goes on to small doses of medicines for whatever they might be taking it. Remember, we got a wide spectrum of patients who haven't had COVID but suffered fear and anxiety, patients who had COVID, and patients whose families had COVID. So there are different sets of fear, and fear, as we know, that covers our rationality, muddles our mind, and makes us more skeptical and more neurotic and more uncertain about things. Where, questions around vaccination has brought out those very fears. We've endured fear for a year, and now that vaccine has arrived, we are not sure whether we should be taking it. And many of the queries are quite rightly so, that people want to know more information. And you quite rightly mentioned at the very beginning that right information will lead to right decision. And seminars like this and consultations lead to that, hopefully collated right information, which will lead for people to make right decisions. And that's principally our job. And that's, I think, principally a job of a psychiatrist or physician as well. What else we do depends on the specialty of giving them right guidance in the right direction. I think in terms of advice, I would say the people who had COVID have been under much higher levels of stress and anxiety. So they need to not have high expectations of reverting and returning back to normal life, work life, education, and so on. As we all know that we need to walk before we run. If you had a knee operation, for example, you can't expect to climb stairs and go for a jog. You're expected to do slow movements with physiotherapy, endure that pain, get the movements right, and then stand up, move slowly, then walk, and then run. Likewise, post-COVID infections, we need to say that we need to get back to things slowly. And by that, I mean, you stick to basics. Get your sleep patterns right, sleep on time, wake up on time. Upon waking up, try to be a little more active than you have been when you were ill, walking around the house, walking between kitchen and the drawing room, and then gradually building that activity level to a point where you're able to go for walks and then start to think about exercises. As Rachna, you quite rightly said that we need to offer hope that almost all people recover from COVID very well. Even those with severe infections who come out of intubations and ICU are recovering. They might take longer, but they will all recover. Well, we know the mortality rates have been very low. The recovery rates in India particularly has been very high, very, very high, I would say. Therefore, even if you have the lingering worry inside you, you almost be assured that you're going to recover. It might take weeks for some, even many weeks for some, but you will get back. So stick to basics, sleep, wake up and be active, gradually build up the exercise level, stick to a good diet and routine, and you will see that you're coming back to normal. Week after week, if you look at your own progress, then what you'll see is that you're doing better this week as compared to last week and so on. And people tend to forget that. So I often tell people to keep a diary to say that how well are you today as compared to yesterday. It's like glass half full and half empty. When we're worried, we only see half empty. And when we are happy and positive, we see half full.
Excellent. That's an excellent point to reiterate for people that after you've recovered from an illness, any illness, and COVID here in this case, don't look at how you were before. Look at how you were at the peak of the illness and then week by week measure progress from there. That is most important, and that will keep you going. And as Roshan pointed out rightly, walk before you can run, and do things to keep yourself positive and upbeat. That's most important. I'm going to come to questions again, because there is a lot of them coming in. So bear with me. I now have, what do we say? Allergic reactions. We've done this. Second phase of vaccination, of course, that will happen. Somebody's asked from a person from community medicine, actually, that the second phase has already started, with the frontline workers, and the third phase will be the over 50. So we are hearing news of that. People are asking about some news of facial paralysis as post-COVID complication in some nations. Yes, there are neurological symptoms, all kinds of neurological issues that have happened post-COVID, including strokes and even heart issues. So all systems have been touched by this virus, affected by this virus. That's true. And then 5-day steaming process. Steam is good for you if you have symptoms, but steam is not going to do anything special, in my opinion, to the COVID virus. You would have, so if my colleagues have anything different to add, they should. And somebody said they have allergy to albumin, and should they get the vaccine? More about steam, and something about COPD. Okay. So at this point, there is no information on if you have albumin allergy that you can't get the vaccine. Somebody said they have COPD on inhalers. They can absolutely get the vaccine also. Just make sure that if you're on oral steroids, which is an immune suppressant, that you have a discussion with your doctor. My colleagues, Dr. Amit, Dr. Khosla, want to add anything on that? Those questions. Are you able to see the questions, doctors? On your
they pop up. Sometimes they pop. I can see them when they pop up.
Okay, all right. So the question was twofold. One was about albumin allergies and somebody who has COPD and they are on inhalers. Any thoughts on both of them?
I think albumin allergy, the manufacturer of the vaccine can answer to that probably. If the vaccine has been developed in an egg cell line or an albumin cell line, then probably maybe if a person is allergic to that albumin thing, then he should not be taking that vaccine. But I think I would not be able to answer. Probably the manufacturer would be able to answer. Yeah.
Right. Right. A good question, and it's something that we can look into. But on the package inserts, they have given a listing of all the components they are there. But as you said rightly, that's a manufacturer question if any egg cell lines have been used. Your experience, Dr. Khosla, on the albumin question?
So same thing. I mean, I would say
and-
just look at the insert and see what the manufacturer has used to make the vaccine. But I do want to point out one thing over here. So our experience in US has been of Pfizer and Moderna vaccine. I did see a question pop up about different vaccines. I'm not going to go into extensive thing about different vaccines, but I can tell you one thing. I'm going to make a quote over here of one of our ex-prime minister who said, Lal Bahadur Shastri, who said, Jai Jawan, Jai Kisan. I think this is the time to stand up and salute the scientists. And I think one of our ministers, I heard his speech yesterday, did that, and he said, Jai Vigyan. Within 1 year, coming out with the number of vaccines that have come out is tremendous. I mean, this has never happened in the history of human science. There are definitely concerns that people have about vaccines, but I can tell you, as Dr. Kucheria had already mentioned in the beginning, millions of people around the world who have already been vaccinated. And if you look at the side effects that they're talking about, they are very minor as compared to the number of people who have had the vaccines. Now, definitely nobody wants to become a statistic, but overall, the safety of the vaccines, I think so far, based on the phase 1, phase 2 trials and now phase 3 trials and now actual clinical use, is very much there. Now, there are different type of vaccines, so you have to be, very, very learned about what vaccine you're going to get. The vaccine is in the US is different. Is your messenger RNA, mRNA vaccine. The vaccines being used in India are slightly different. The vaccines made by China are slightly different, but the safety profile so far has been encouraging. So if any patient comes to me, like your question was COPD, definitely, I'm a lung specialist. My patients are asthma, COPD. Definitely, until unless they have the 2 contraindications which are listed, which Dr. Kucheria had already highlighted, or any prior severe reaction to any other vaccine, which is not absolute contraindication, which is a discussion with your physician, is where your caution lies. But overall, I would say go ahead and get it. And I think there was one other question that had popped up. What is that, is one vaccine better than the other? The answer is very simple. There are no head-to-head trials of different vaccines. So basically vaccines have been tried with a placebo. So all we know is that vaccine against a placebo of the results that have come out. So we can just guide you based on the research that has been done against a placebo. We can't say if Covishield is better than Covaxin or Pfizer vaccine is better than the Moderna vaccine. There will be no head-to-head trials of them.
Well, this is a vaccinated group here. Would you like to tell us about your experience, Dr. Amit, since you are in India and we have a mostly Indian audience here, or Dr. Jain, Roshan? Yeah.
Yeah, I'm running a hospital, and almost 30 staff members of ours, they have been vaccinated in India, and none of them, I'm telling you, none of them had any severe allergic reactions or any side effects. The commonest side effects were injection site pain, maybe a little bit of fever, a little bit of headache, myalgias, but they were all manageable and they were gone in 2 days. So very, very light side effect, very, very less side effects. And I must say, everybody should go for vaccination.
Excellent.
Yes.
Dr. Jain,
And,
how about you?
Yeah, I was vaccinated, and very earlier on, all my colleagues, doctors, nurses, every staff at Apollo has been vaccinated. We only heard of injection site pain, which happens with any injections. Even if you take B complex injection, you get injection site pain. Body pain, very mild in the morning. It just took, I think I didn't need a Dolo, but with the apprehension, I just took a Dolo 650, and the body pain lasted for 2 hours, I think, and that was it. No other side effect, no reactions, luckily. At Apollo, we have more than a few thousand staff and 3 Apollos in Bangalore. We haven't heard of any major reactions, allergic reactions or problems. I've assured many people to say that doctors have served the patients throughout the pandemic, and now we have offered ourselves to be the guinea pigs to take the vaccination. Dr. Khosla very clearly said that efficacy is what has led to a lot of skepticism because of the data. But the safety profile of all the vaccines, many of the vaccines in UK, US, and India have been established that they're by and large safe, bearing minor reactions, but mostly they're safe. How efficacious they are, or how much protection they'll provide, only time will tell. I have assured people to say that some protection is better than no protection. And if this can add to the fourth layer of the hand wash and mask and social distancing, vaccine is a fourth layer. If it's offered, you must take it. I've taken it. So I would definitely go for it.
Right, and I will add there, like you rightly said, don't forget the mask and safe distancing still, because one thing that we should make very clear is the vaccine is helping reduce, or it's showing, but when we talk about that efficacy, that numbers you see, the 94% and the 76%, it is basically reduction of symptomatic cases or severe cases. It is not stopping infection altogether or asymptomatic cases, right? So still those other measures are to be taken, because it will take a while for the population to be vaccinated, and also we don't know how long it's going to last. And you know, the world is porous. So if some other place is experiencing a second spike or a third spike, you know, we have people, it's porous, we have people going in and going out. So, you know, we can't let our guards down. I know we are breathing a bit of sigh of relief here. There was pandemic fatigue, but all in all, I think masks are a part of our life, safe distancing, and here to stay for a while. And I'm just going to take a few more questions that have come in. Let me start from the bottom, actually. And you know, specific questions about specific patients, I will not be taking. It's not fair, because you know, it really should be like, there are people who are asking about discharge from hospital and they're on blood thinners. How long do they continue? D-dimers. These are discussions best had with the hospital doctor who is looking after the patient. There's a lot of many things involved in these decisions, so it's not fair to answer them on a webinar like this. It's safest for you to have a discussion with the hospital doctor who was managing the patient. Also, people have asked which vaccine is safer, Covaxin or Covishield. Well, safety profiles for all vaccines are approved before they are given emergency use authorization also, as was in this country. It's only efficacy data right now that is pending for Covaxin, which we hope to have in March. So unless safety profile is proved, to whatever extent can be, up to 2 months after the last dose that they've seen in the data, these are not released to the public. So, and as Dr. Khosla pointed out, there are no head-to-head trials, comparisons between the two, but in general, for any vaccine that is released to the public, safety is assured first. However, with the cautions that we spoke about earlier in the talk today, about if you have any of the conditions that they are asking to be cautious about, then you need a consultation with the person who's going to vaccinate you, the doctor who's going to vaccinate you, or your own doctor before you go in. So that's important. And no, somebody's asking, people are asking if I'm allergic or if I'm asthmatic, you can go ahead and take. But again, if you're on steroids, a discussion is needed. If you're on blood thinners, these are all questions that are coming up. A discussion is required before you take the vaccine. Somebody's asking, should I take a steroid? I get urticaria before the vaccine. No. Again, yeah, go ahead. Somebody said I have urticaria. Yeah, go ahead. Yeah.
No, you should not be taking steroids, because it will decrease the efficacy of your vaccine, because steroids are immunosuppressants. So if you take steroids, your body is not going to make immunity against the virus. So you should not be taking steroids.
Excellent. Thank you, Dr. Amit. We'll take a few more. As I keep going down, we get, for how long vaccine will be effective? We don't have an answer to that yet. Again, in many ways, all of the globe is part of what we call a phase 4 trial. And very rightly, as Dr. Khosla pointed out, Jai Vigyan, this is stupendous, what has happened in these months. And remember, vaccines and the genetics and the molecular scientists, the bench scientists who, as we were training and through our years, they were in some dark little laboratories. They have been so essential in what we know about this virus, how to tackle it, how to make the vaccines, how to change them, where it's spreading, how we should, manage the borders of populations going here and there. This is all coming from hardcore, a lot of the work that is put in by bench scientists. So Jai Vigyan. So long answer to the question of how long will the vaccine be effective? We are still finding out all those things, and fear not, scientists are on it. As I said, some of the news clippets I have, and I'll go over a few of them. So very recently, in the UK, it's been found out that even after one dose of Covishield, people get 76% protection. Where initially Covishield vaccine, the Oxford vaccine, was a 4-week interval. They are now saying that if they give it after 12 weeks, then the protection offered is better. It's over 80%. So what the point I'm trying to make it is, as the vaccination is going on and as data is being collected, scientists are very fast in moving, collating this data in a scientific manner, in a scientific research study manner, and getting it out to the public in a way that it makes a difference to the vaccination programs, to the policies that the governments are making. Would you like to comment, Dr. Khosla?
I would like to add to that. Yeah, I can add to that. If we see our experience with the other viruses, our body's immune system, there are two things in it. One is that we have active antibodies in our blood, which we see just post-vaccination for maybe for a few months. But there is something which is known as an immune recall. So if we have had an exposure to a particular virus and that our immune system has a recall to that, then if we are exposed to the same virus later on, maybe after 5 years, maybe after 10 years, we may not be having active antibodies against that virus at that time. But if we have an immune recall to that virus, our body will mount a strong immune response to that virus in a very short time. So that immune recall is going to stay even if there are no active antibodies. So you should take the vaccine.
Fabulous, Dr. Amit, which also brings the point that you have excellent science and medical class recall. 30 years ago, what we have learned, it's fabulous. And, that's why we are so lucky to have people like you also on this panel. You're able to recall it and, connect the science and the dots. And that is what good physicians and scientists and public health scientists will do for you. All the answers may not be in the books. It comes from, the basic learnings and being able to put it into practice in a manner that is meaningful for you. So absolutely, thank you for that nugget. I myself had forgotten it. Dr. Khosla,
can I just add one more thing?
Yes, of course.
The
Please.
concern that people are having about the vaccine technology. So remember the latest type of vaccine which the world has not seen before, the messenger RNA vaccine, that is not there in India. What India is producing is the technology that is being used has been used for years to manufacture vaccines. So your MMR vaccine, measles, mumps, and rubella vaccine, is made by the same technology that the Covaxin is being made by using an inactivated virus. In China, the Sinopharm vaccine has been made with a similar manner. So you do have some data over there, although yes, you want to know exactly what the vaccine that you're going to get, the efficacy results of the same. So keep that in mind, that the vaccine technology that is being used, even the vector virus vaccine, which is your AstraZeneca vaccine or the Covishield vaccine, the technology has been there before, has been used in different vaccines prior to this. So the bench scientists know a lot about it, and your manufacturer that is there in India is one of the largest producers of vaccines in the world. So they have a very, very good track record of making vaccines. So, hats off to them. India is one of the largest producers of vaccines. It's amazing to know what they're doing. So, you feel proud as an Indian sitting abroad.
Excellent, excellent. And also the massive vaccination program as well that is being rolled out. And of course, we also do want to keep our eye on any of the adverse effects that are happening. Well, we are technically at the end of our webinar, our 1 hour, but I will take a few minutes. It was amiss of me to take I've answered the questions, but perhaps I will take a couple of the names that people have sent and make sure that their questions are answered. Well, I'm getting storage facility, Mr. Chatwal, we don't have answers, that's the government, and they have, there's lots of information on the web on their storage facility and how it's getting to the last mile. For Mr. Chatwal, after first dose of Covishield, can we do antibodies to know the level of protection from Mr. Ravichandran? Anybody want to tackle this?
I can say that well, we're not using Covishield, but in US there is no recommendation to test antibodies after a first dose, or we are not even recommending after a second dose. Now, if you're in a research study or you're doing a research trial, that is different. But in clinical use, it's not recommended.
Excellent. Right. And Mr. Ashwin Seth, I think I answered your question earlier about the blood thinners, that you should have a discussion with your doctor. And somebody asked about Mr. Krishnamurthy about the patient who's 74 with asthma and hypertension, no steroids so far. Then from the data we have currently for both the vaccines, they should be safe for you, either Covaxin or Covishield. Right now, the safety data is not compared head to head, but it is safe, as I said earlier, so it's back. My panelists, in case anything is different or you want to add on, I'm going to move fast now since we're at the end of the webinar. Please do jump in and say that you want to add on something. Then we have, I talked about Mr. Seth again, the urticaria issue. Blood thinners, Aruna is asking about brother is on blood thinners after a stroke. Can he take COVID vaccine? This is a discussion for your doctor. He must, because both the vaccine inserts are saying Covaxin actually is saying not to, and not to take. And for Covishield, it's a discussion with your doctor before you take it. So definitely you're in the discuss with your doctor category. Geeta Rajaram has asked about ICMR report saying 25% of population affected by COVID. These are extrapolation data based on sero surveys, sample sero surveys done on some 30,000 people. So it's not ever an exact number. These are extrapolations. Aruna is asking about mother was admitted with COVID with severe lung impact, discharged after 18 days with continued oxygen at home. Diabetes and 74 years. She still has sleeping problems and fatigue. Dr. Khosla, do you want to take that really quickly? I know you've mentioned most of the aspects, but for this particular person, continued oxygen at home, diabetic, 74 years, still with problems of sleep and fatigue. I'm sure you're seeing many in your clinic. Any thoughts, any suggestions?
Yeah, I think this is a patient who needs to work very closely with the physician so that they can guide them the best. As you said, it's difficult to, without knowing particular details of the patient, to comment on the webinar. Oxygen requirement may or may not persist. So work closely with your physician. They may need somebody like Dr. Roshan's help with their anxiety or insomnia or depression that they may be having. It needs to be worked up well. So yes, please work closely with your personal physician. Okay.
And somebody asked if India will receive Pfizer and Moderna at some point. We'll all get to know from the newspaper when we do. Sorry, go ahead. Yeah, Roshan.
I think just day before yesterday, I read that Pfizer has withdrawn application for emergency use in India. So, right, which means that I don't think India is geared up for having -70-degree storage facilities across cities. Forget there's rural areas. So, I think from what I read, we might not get Pfizer vaccine at all in India. They are withdrawing their use in India altogether.
Right, and I didn't get to this because we ran out of time. But there are many in the pipeline. Sputnik will be asking for approvals. I think that will come up very soon. Yes. The other one would be Zydus Cadila, which would come up soon. We have the J&J Biological E, which is a one-dose vaccine. I think they have good phase 3 data, and so many of these, which are very close in the pipeline, should be applying, I think, for India approvals. So I think by March, April, we may have 2-3 more vaccines and hopefully a one-dose one. Somebody has also asked about, and I'll take their name so that they know that their question is being answered, about does he have an option? Here, just a second. Yeah. So Mr. G. Ravichandran, can we take the second dose vaccine 3 months later voluntarily? Anybody want to tackle that? We have the Covishield and it's recommended 4 to 6 weeks, but now the new UK data is coming out for 12 weeks. So it's a good question this gentleman has. But I will say this, that right now, there is no recommendation as such. There has to be formal recommendation, like we said, from the vaccine manufacturers. So this research is out there, but right now the vaccine manufacturer has not adopted it to say that, you should take it 12 weeks later. So I would still stick with what the vaccine manufacturer is recommending. Any other thoughts on that? to my
I would say the
panelists?
same. Stick with what the manufacturer is saying. But definitely, for whatever reason, if you end up missing the second dose at the recommended time, I would definitely say go back and take it whenever you can. The idea of the second dose is to boost your immune response after the first dose. So and that is how they tested it, the test time period. There's always a range of that time period, but they give you the median or the average for the second dose. So definitely just follow the instructions of the manufacturer. But if you miss it, go ahead and take the second dose when you can. But you can probably consult your physician prior to doing that.
Right. Okay. So before I close today's webinar, I'm just going to go around and ask you all for some 30, 40 second, 1 minute closing comments, some takeaway that you would like to leave the attendees with. Thank you all of you for giving us the time that you did. So in alphabetical order, I will start with the earliest roll numbers. Dr. Amit, you want to start with some takeaways for our audience today?
So takeaway would be that we are probably at the end of India, probably. I'm talking about India. I think COVID is going to end very soon in India. So everybody should stay positive and take the vaccine and stay positive. That is my takeaway. Yeah.
Excellent. Thank you.
Yeah.
Roshan, I'm coming to you. J is before K. So.
And I always emphasize that right information will lead to reduce negativity, reduce skepticism, reduce neurosis, and your use of energy in the right direction. So get the right information from right source, governmental sources, and if in doubt, ask, consult. And many of the questions are related to specific individual issues. We have much information in the domain, but some of them are specific information. Do consult. If in doubt, consult. That's what the specialists are there for. They will guide you in the right direction. Do not use your energy, spend your energy in the wrong direction. Ask, help, seek help. There's nothing wrong in it. Clarity, leads to resolution of all problems.
Excellent. You did my job for me. Ask and don't put the energies in the wrong direction. And for many people this evening with the very specific questions, again, I want to say that ask your specialists. Dr. Khosla?
So again, thank you
to
for the
leave us with?
opportunity. Yeah, thank you for the opportunity for having an excellent discussion with the co-panelists. What I would say is we've been through a lot over the last year. The light is at the end of the tunnel. I think we all are going to come stronger out of this. Don't despair. Don't lose hope. Science has helped us along the way. Is going to help us in the future. The only word of caution is, even though the pandemic seems to be abating in India, please keep taking the precautions as the government is telling you,
Right.
at least for a while, so that you want to see the back of it completely before you say your last hurrah.
Yeah.
Fabulous. I couldn't have ended better. That everybody, if you've been some of the fortunate ones who did not get the infection last year, what you were doing to stay safe, wear your mask, have the distance, continue to do that. This is a really wicked virus that we are still wrapping our hands around. So, no letting down of the guard. Vaccination is one solution. It's one of the menu items. It's not the only menu item. And wait patiently. I think the government has a plan and they are rolling it out slowly. The safety of the vaccines is, they're all comparable. They're proven before they come out to the public. And more and more data is being released with scientists and doctors working around the clock. So with that, and stay safe, all of you. Again, please consult your specific doctors for very specific questions. Thank you all for joining us, and everybody continue to stay safe. Have a good rest of the day wherever you are in the world.
Thank you. Thank you so much.
Thank you.
Take care.
Thank you. Bye.
Thank you
Bye.
so much.
Bye.